Care. Welcome, Rosa. Thank you, Neves. On behalf of the Chronicity and Integrated Care Service at the Basque Public Health Service, I would like to thank the organizers for giving us this chance to be here today to tell you about our experience in improving integration, which is something that we all want to achieve, and we want to improve at the end of the day the continuity of care and that care pathway for patients. Apologies, but the light is shining in my eyes. I don't know where you come from, those of you who are listening to me. If you come from anywhere but the Basque Country, I would like to tell you a little bit about our region. Here we see it on the map. Some 2,300,000 inhabitants in the Basque Country. The area, the surface area, is made up by 3 different provinces, just over 7,000 square kilometers in total for our region. And we are an autonomous community, which means that in the Spanish political system, we had a number of powers devolved, one of them healthcare, and we raise our own taxes to do so. So we have 2 different structures within our system, one that designs the system and decides on the funding of a system, and then OSAKIDETZA, which is in charge of service delivery. OSAKIDETZA, the Basque public healthcare system, was set up in 1983. We will turn 35 this year, and so since 1983, OSAKIDETZA has been in charge of all the resources, whether it's material or human resources, covering the whole of our region. And then in 1988, well, that was our real landmark, because that was the time when we were given all those powers fully from the government in Madrid. We are happy with our system, with our planning, and our objective is improving healthcare and quality of life through public high-quality services. In 1983, doing so was quite a challenge, and then back in 1990 there was another landmark. We had to comply, well, we decided we wanted to comply with quality systems, originally EFQM, now the Advanced Quality Model, and that continued up until 2008, which is when we decided to tackle the population aging challenge and the chronic pathologies channel. We all know how aging population is a huge challenge. It's not a pyramid anymore. Look how thick that polygon looks on the sides, halfway through, and then the peak just for women. And let me tell you or remind you that life expectancy is very high in the Basque Country. We are one of the longest living areas in the world. We know that by 2040 there will be twice as many chronic patients over 65 years of age, which was around about 20% in 2011. I also want to tell you that we are really changing, transforming, I say, our biomedical model. Not so long ago, healthcare really focused on acute patients and structures, but in 2010 we decided to change our care model. You will see how. Our initial idea was that we wanted to start going towards this integrated care model with people and patients as our focus, and also making the most of the synergies with the community, with the patient's environment, with society. So focusing on health. In 2013 and 2014, we designed our integrated care plan for the Basque region. I would like to recommend you to get a copy of this plan. Just go to our stand outside OSAKIDETZA stand, and we will let you have a pen drive with it, so that there's less fragmentation, more efficiency, and better integration of care in our services. That's what we want to achieve through integration. So how far have we come in this journey towards change and transformation? I'm going to give you very global, very general results, but let me just remind you that the program includes other presentations, much more detailed programs and specificities. My facts and figures will be rather general, as I said. There has been a gradual joining of different units. We had, which is what we call OSIS, and then for mental health, there is a specific network that's been set up as well over the years. Right now, the structure for OSAKIDETZA is 13 integrated organizations or OSIS, 3 networks for mental health, the Basque Center for blood transfusions and human tissue, our oncological foundation, our general offices, headquarters. Well, that's the general structure. We have carried out 4 different stages to better stratify our population, so that we can be more proactive and better focused when we target our interventions. Look at that, 69,000 people with multi-pathology, with a number of different diseases, and we are addressing them directly, very intensively, for 16,000 of those. We fortunately have good integration for technologies. We have one single history as well for all different healthcare professionals, and that's fully implemented, has been fully implemented 100%. We also have different ways and channels for professionals to ask questions to specialists, and can do so not face-to-face as well. 100% of our hospital services have technology, so that doctors and nurses can access patients' history and all information at the foot of the bed remotely. I forgot to mention earlier that the details I'm giving you are the result of our latest report for 2018. And if any of you want more detail, please let me know, and we will send you more detailed information. Electronic prescriptions were very innovative, and here we can see the progression over time. The evolution shows that some 27% increase is the the trend for prescriptions that are given electronically. You can see here the number of patients that access electronic prescriptions. It's being accepted very, very well. Some 850,000 prescriptions in the year 2018. Here we can see the healthcare folder, which allows for better interaction between patients and healthcare providers. We can see the 3 different channels for content to be included in these folders. You can see also using messaging technologies through training and education.
Ves que ha habido a lo largo de los años un incremento tanto en la consulta de citas pendientes.
We can see that we have been doing much better as well for accessibility, for vaccinations.
OSARIAN, o dentro de lo que llamamos
OSARIAN, it's a health advice that is run by the emergency services, by a group of nurses, 24 hours support all year round. And here, that there is an increase in terms of the number of calls. And the increase is not the important bit, but it's to show how many of these calls are being resolved by this group of nurses. With regards to a social health approach, we have a shared medical record.
He pulsado muy fuerte, ¿verdad? No. Ponme aquí. Aquí, sí. Dentro de los socios.
So a number of priorities have been identified, 2017 to 2020, with regards to the deployment of the RAI-CA as an assessment tool. Out of 594 identified cases, more than 594 cases have been dealt with out of 1,123 cases. And right now, this is something that has been done between the local authorities and health services. We think that the health routes is a tool that allows us to integrate and that brings together different professionals that are involved in or that have an direct impact on patients with specific diseases and conditions. And a guide is being drafted and will be published this year. And at this guide, we have defined the routes, what are the main key features that these sort of routes should include. And then there's a diagnosis being conducted in terms of what's the status of the existing guides in OSAKIDETZA with regards to the criteria that we consider that the health guide should include. Something else that we have carried out is the new professional roles. I prefer to talk about broadening competences. Integration requires to increase skills and to have the GP and the nurse as reference, to have the nurse in the hospital care, the internal physician as a reference as well. With regards to community health, there's a working group that has been made up by OSAKIDETZA and the health department, and more specifically with public health. And a methodological guide has been developed. A number of awareness actions have been developed, and also an action plan to have a community type approach. This is Osasun Eskola. It's the patient school to try and engage and involve patients so that patients are more active. And within Osasun Eskola, we have the active patient program. There's been 538 courses, and there's been 6,455 patients that have received training and 310 trainers. And I'm nearly finished. And then, to conclude, we have also a set of tools for assessment purposes, and we have the framework program or framework agreement, and the funding system with OSAKIDETZA, with the Basque Health Service. And within this framework, there's one item related to integrated care, and we have different sub-indicators. And if we look at the indicators since 2015, we see a positive trend. Last year, in a corporate manner, we used the GESPA. It's the patient experience assessment tool, and in one of the items, it's asked whether patients are coordinated. If professionals are coordinated, and in out of 5, we were at 3.5. With regards to the satisfaction survey, there's a new point within the survey, and it covers integration. So 0 to 100, and the is a global approach. So, and we rank at 6.58. So, on the other hand, we have two tools, which is called the love tool, the d'amour questionnaire, and the tool out 1 out of 5, from 0 to 5, it would be at 3.61. And then we have the IEMAC, the chronicity care assessment model, and we would be at 62% out of 100. And that was it. Thank you very much.
Muchas gracias, Rosa.
Thank you, Rosa. Any questions? You've been very busy over the past 8 years, I would say. Hello, my name is Pedro Garcia. I'm a doctor at ER. In Santa Marina Hospital, we have people with chronic disease. Rosa, we've seen that over the 8 to 10 years, there's been a change in the structure, a professional and cultural change in our organization. In your opinion, what has been the most difficult to change? People, the structure in OSAKIDETZA, departments? What's been the biggest challenge? What's been the biggest obstacles? Well, people that make up OSAKIDETZA. This has meant a cultural change at the end of the day, and cultural changes cannot be reached overnight. It takes a long time. So what takes most effort is to change that mindset, to change that culture, to view things in a different manner. And I've already said that this biomedical model that we had is not completely inexisting now, but it's disappearing little by little. But viewing the patient in a different manner is very important. But we're all struggling in a way. But there are the people who believe in it, and I know that many people believe in this change. We go little by little, and we do make changes. Thank you very much. Any other question? My question is a bit the continuation of the previous question. There still needs to be work done, and the purpose of this conference is to learn. One of the purposes and experience of people who have worked in integrated care. What would you do different? So if you look at hindsight, so sometimes you can look back and say, well, it would be better if we hadn't done that. Well, now we have more the involvement of patients. Things are done not only for the patient but with the patient, and I'm talking in a holistic manner. And I think this is changing. And we are all learning. This is an ongoing task, and that it needs to involve all professionals, and that we all can contribute to this change. But first we have to believe in this. We are trying to make patients protagonists and professionals. Big hospitals and have been built for professionals and not sometimes for the well-being of patients. Thank you very much. Any other question? Thank you very much, Rosa, again.